Hello and welcome. Today we're diving into a condition affecting the kidneys, lifeline renal artery aneurysms. We'll explore what they are, why they form, how they're detected, and the ways we can manage them to protect your kidney health. So, what causes these bulges in our renal arteries? While the exact etiology remains somewhat unclear, several factors contribute to their development. These include congenital weaknesses in the artery wall, uncontrolled high blood pressure, atherosclerosis or hardening of the arteries, fibromuscular dysplasia, a condition that affects the walls of the arteries, genetic disorders such as Ehlers-Danlos syndrome, and in rare cases, trauma or infections that damage the artery wall can play a role as well. It's often a combination of these factors that leads to the formation of a renal artery aneurysm. Let's delve into the pathophysiology. A renal artery aneurysm is essentially a weakened area in the wall of the renal artery, the major vessel supplying blood to the kidney. This weakness allows the artery wall to balloon outwards, forming an aneurysm. As the aneurysm grows, it can compress surrounding structures, potentially reducing blood flow to the kidney. This reduced blood flow can, over time, lead to kidney damage and hypertension. The biggest risk, however, is rupture. If the aneurysm bursts, it can cause severe internal bleeding and become a life-threatening emergency. Renal artery aneurysms are considered relatively rare. Epidemiological studies estimate that they are found in less than 1% of the general population. They are more commonly detected during imaging studies performed for other reasons, often incidentally. While they can occur at any age, they are more frequently diagnosed in adults, particularly those with pre-existing conditions like high blood pressure or atherosclerosis. Women are also slightly more likely to be affected than men. Now, what are the signs and symptoms? The tricky thing about renal artery aneurysms is that they are often asymptomatic, meaning they don't cause any noticeable symptoms, especially when they are small. Many are discovered incidentally during imaging tests for other conditions. However, larger aneurysms can cause symptoms, including flank pain, pain in the side of your abdomen or back, high blood pressure that is difficult to control, or even hematuria, blood in the urine. In rare, severe cases where the aneurysm ruptures, symptoms can include sudden, severe abdominal or back pain, dizziness, and signs of shock. This is a medical emergency requiring immediate attention. So how are renal artery aneurysms diagnosed? The diagnosis typically involves imaging studies. A computed tomography angiography, its CTA scan, is commonly used as it provides detailed images of the renal arteries. A magnetic resonance angiography (HIMR) scan is another option, especially for those who can't tolerate the contrast dye used in CTAs. A traditional renal angiogram, where a catheter is inserted into an artery to inject dye and take rays, can also be used, but is less common now due to the availability of less invasive techniques. Ultrasound, particularly Doppler ultrasound, can also be used to assess blood flow in the renal arteries but may not always visualize the aneurysm directly. Renal artery aneurysms can be broadly classified based on their location and morphology. They can be saccular, meaning they bulge out on one side of the artery, or fusiform, meaning they involve the entire circumference of the artery. They can also be classified as intrarenal, located within the kidney itself, or extrarenal, located outside the kidney. The classification of the aneurysm can influence the treatment approach. The treatment and management of renal artery aneurysms depend on several factors, including the size, location, and symptoms of the aneurysm, as well as the patient's overall health. Small, asymptomatic aneurysms may be monitored with regular imaging scans to watch for growth. Larger aneurysms, or those causing symptoms, often require intervention. Treatment options include endovascular repair, where a stent graft is placed inside the aneurysm to reinforce the artery wall, and open surgical repair, where the aneurysm is surgically removed or bypassed. The choice of treatment depends on the aneurysm's characteristics and the surgeon's expertise. Medication to control high blood pressure is also an important part of management. Unfortunately, there isn't a definitive way to prevent renal artery aneurysms altogether, especially those related to genetic predispositions. However, managing risk factors such as high blood pressure through diet, exercise, and medication is crucial. Maintaining a healthy lifestyle, including not smoking and controlling cholesterol levels, can also help prevent atherosclerosis, another risk factor. Regular check-ups and screenings, especially for those with a family history of aneurysms or other vascular conditions, can help detect aneurysms early, when treatment is often more effective. The prognosis for patients with renal artery aneurysms is generally good, especially when they are detected and treated early. Monitoring small, asymptomatic aneurysms allows for intervention before complications arise. With appropriate treatment, most patients can avoid serious consequences such as kidney damage or rupture. Recent research focuses on improving endovascular techniques to make them less invasive and more effective, as well as on identifying genetic markers that may predispose individuals to aneurysm formation. Ongoing studies are also exploring new medications to stabilize artery walls and prevent aneurysm growth, offering hope for even better management in the future. Remember, early detection and proactive management are key to a positive outcome.